I'm not great at these, so I apologize. I think all of us are getting a little more skilled at webcams and Zoom meetings and so forth. Anyway, hi to all my patients at Granite Dental. I wanted to send a message. It's been a month now. Most of you I haven't seen. Some of you have come in on emergencies. It's been a pleasure to take care of you. Now we're kind of looking forward to what happens in the future, and I wanted to share what I know and share what I don't know. First thing is, today's the 23rd of April. Did I say that right? Yeah, today's the 23rd of April. Governor Brown in Oregon just made an announcement that on May 1st, dentists will be able to go back to work and do non-emergent care following certain guidelines. Our Governor Inslee, still hasn't said anything. Currently, our open date is May 18th. In spite of that date, whether or not it moves, I wanted to reach out and let you know some things will probably need to change in our dental office, like everywhere. But I don't know what those things are. So really the message is meant to be short, but I wanted to make sure I reached out to all my patients personally. We have practiced universal precautions according to the CDC guidelines my entire career. At Granite Dental, we've always been very cautious about your health. We take that seriously. Understand from our perspective that our profession is one of the highest risk professions for my staff and I of any healthcare profession. We're exposed to sickness constantly, all day, every day, and so everything we can do to mitigate that works in our favor. That's how we're able to stay open and stay healthy and prevent both the spread of disease from us to you and from you to each other. So we've always taken that seriously. Unfortunately, right now there is not a lot of data. For instance, in the state of Massachusetts, they've closed all schools, including Harvard and MIT, until the beginning of 2021. Because that's how their politicians have decided to interpret data. On the flip side, Utah opened all of their dental offices up today and said that people are safe and no change in PPE, that all current recommendations that were in place prior to the COVID outbreak are sufficient to keep people healthy, and then there's everybody in between. So we simply don't know what we will do. What I wanted you to know is that one of the things that we will have is some kind of a sanitation or a health spa or whatever we decide to call it, where you will have gloves and masks and alcohol hand wipes and things of that nature if you want to use those. We will, of course, be doing some sort of an enhanced screening. Patients that have been sick or exhibited symptoms of any communicable disease, not just COVID, but flu, and I've had the cough, I have a runny nose, things like that, we may defer care for a couple weeks until you're healed so that you don't spread to other people. We may change the layout of our waiting room. We may almost for sure change the time blocks for scheduling patients because we'll need more time. We may or may not be wearing additional PPE than what you're used to. We don't know. We may be open on Fridays and or Saturdays. Again, we don't know. So we want you to know that we are thinking of you, that we are as interested in you are as getting you back to health as quick as you can, getting you back into your routines. We understand that the longer you're away from your routines, the more your health is jeopardized, and all of us sitting at home and the stress of not being able to work and not having our life normalized does wreak havoc in our oral and systemic health, and so I understand that. If you have any questions or concerns, feel free to call us. We definitely want to make sure that you're comfortable. We want you to know that you're safe. We want you to know that you'll receive excellent care. We also want you to know the estimates are that somewhere between 30 and 40, maybe 45% of dental offices across the country are considering closing after this, which would create a nightmare. I hope that isn't the case. I think many in our county, unfortunately, have been considering retirement, and there's a lot of buzz about people that have been considering retirement just simply not coming back to work, in which case many of your friends and family members will need a dental home, and we'd love to take care of them. You've had a positive experience with us, and we invite you to reach out to your friends and say, look, my dentist is open and my dentist is willing to take care of you. Again, any communication we welcome. If you need to call me personally, please do. You can leave messages on our phone. We check it all day long, every day. The last thing, too, related to finances. Look, the only reason that I'm able to open is because my bank immediately came to me and said, hey, Dave, look, I know you don't have an income. We're going to freeze your payments for a time. And at Granite Dental, we feel the same way. Like, if you owe us money, and I have absolutely no idea who owes money, so I don't want you to let that come between you and I. I keep myself out of that so that I don't have to have any damage to our relationship based on money. But if you owe us money and you can't afford to pay, or if you could afford to pay but now your finances have changed because of this, please just reach out and let Rachel or Chris know. We'll make payment plans. We are here to support you, and we want you to feel supported. We certainly don't want to be the straw that breaks the camel's back financially for you or your family. So please make sure you communicate with us. Any concerns, let me know. Otherwise, hope to see you soon.